or going out to schools, to churches, to other community organizations to provide hands-only CPR training, stop the bleed training. We work with community groups to make their staff and their members more resilient, more able to prepare to respond to whatever immediate crisis they're facing. We also try to push out all kinds of communication to our partner organizations to let them know about upcoming grant opportunities, training opportunities, other programs that might put needed tools into their hands. So we have a very active AED program, for example, where we place AEDs out into community centers, churches, civic centers, what have you. We also work with at-risk individuals. So we do participate in a lot of health fairs. With the WOW van, we go out doing a lot of health screenings with different community partners. And then we also try to build social connectedness. So we sponsor our quarterly Spark meetings, usually at the Pavilion in Marion. We have our annual integrated preparedness planning workshop where we work with our community partners in order to craft our training schedule for the next 3 years. And then just yesterday was our annual Weathering the Storm conference, which brought about 300 individuals interested in disaster preparedness together to all learn together. Next slide, please. So here at the RHCC, which is located at the Southern Illinois Airport in Murfreesboro, just across from the SIU Transportation Education Center. Here at this facility, we have an operations center. So for example, during the recent eclipse, we had staff here at the RHCC that were monitoring hospital bed capacity. We're monitoring traffic patterns across Southern Illinois so that if there was any kind of cascading crisis, say a motor vehicle accident involving multiple vehicles, how were ambulances going to get to that scene? How were they going to transport patients, to the closest appropriate facility when we know we had all kinds of gridlock on the roads due to the influx of people that were here for the eclipse. We have a warehouse here at the RHCC where we have all kinds of ready supplies that we can push out to community partners that may be responding to some sort of crisis. We also have a lot of specialized equipment. So we have 2 licensed off-road ambulances. We have a trailer that is filled with water purification equipment. We have a decon trailer. We have a couple of morgues. And then we also can set up temporary medical treatment stations, as you see in the picture there. Next slide, please. So we would also, through the state's ESF-8 plan, we would be the hub in a hub and spoke model, as some of you may have seen during the pandemic, that if assets are being released through the Strategic National Stockpile, most likely they will be coming here, and then we will redistribute them to our community partners that need them. So whether that's PPE, whether that might be ventilators that need to go out to EMS units and to hospitals, different medical countermeasures, all of that is probably going to come here first, and then we will redistribute it. Next slide, please. So I've already mentioned the Weathering the Storm conference that we held yesterday. We also have our mailing list. So anytime any kind of useful information comes to us, we push that out to our community partners. We push out a lot of, we try anyways to push out some annual special funding programs with whatever surplus budget we might have at the end of our grant cycle. We have all kinds of training and exercise assistants. So some people may know Marty Hagan. He is our full-time training and exercise coordinator. So any of our Spark partners that are planning a tabletop or some kind of functional exercise at their facility, we are happy to assist with that. We also have Tamara Caffey Bay, who helps facilities with site-specific disaster plans. We also have a lot of equipment that we're willing to lend out. So if you have people within your facility that are already trained to teach CPR or teach something like Stop the Bleed, we're happy to lend you the mannequins, lend you the training equipment so that you can do that training in-house. Of course, we're also happy to come and provide that training if necessary. Next slide, please. This slide here just talks about our COVID response. So again, I mentioned that we were the hub for distribution of items from the Strategic National Stockpile. So we were pushing out all kinds of PPE, ventilators, CPAP machines. We worked with hospitals and the Illinois Department of Public Health to get agency staff into hospitals that were understaffed. We had the ultra cold storage capacity here. So again, for a time, most of the Pfizer coming to this region came through here. We were also the hub for distributing a lot of the treatments and monoclonal antibody treatments that came to this region. We also worked with the Illinois National Guard and set up 164 individual pop-up vaccination sites and vaccinated about 11,000 people. Next slide. We also have our Wellness on Wheels mobile unit. So in the lower picture there, we have a 42-foot RV that's been converted into a mobile clinic. So we provide the space, we provide some equipment, we provide the driver who can also act as a medical assistant in some limited capacity. But then we'll work with federally qualified health centers, local health departments. We work with hospitals, we work with SIH in order to create opportunities out in the community for people to get basic health services that may not otherwise have that access, whether it's due to transportation issues, insurance issues. Again, we try to make basic health services more accessible to people. We also work with the U of I Extension Service with our nutrition wagon in that upper picture. So working with U of I, they've got dietitians and nutritionists that teach classes about healthy eating habits. So if anyone is interested in more information on that, I'll put my contact information in the chat later. Next slide. I'm seeing a blank screen.
I think that might have been it for your slides here. Yeah, so that was the last one on the slide deck that I have.
Oh no, that's it. The next slide was just going to say questions. So I'll open the floor up to any questions.
So Aaron, I kind of have a question for people that are interested in getting involved with RHCC or even Spark for that matter. What's kind of the easiest way for folks to get connected with you all?
So I just put our generic email address into the chat. I'm now putting in a website. So people that would be interested in working with Spark or joining Spark, it's completely free to sign up. You want to just go to sparkcoalition.com, click on the membership tab, and that'll take you to a portal where you sign up for our mailing list. And then you'll get regular updates on when the next quarterly meetings are, when we have upcoming trainings, other events that we might be hosting that people may be interested in getting involved with.
Okay, great. And I happen to see that the Weathering the Storm made the news yesterday, so congratulations on a great event there. One other question, and this is kind of relevant to the recent news out of Florida and North Carolina. I guess I've heard that some private citizens are trying to get in and help, and that's not really recommended. Can you talk a little bit about that and why that might be?
Yes, so something that we talk a lot about when we're teaching incident command courses or other preparedness courses is that you want to have an organized response. We try to discourage people from just self-deploying to a disaster zone. It's best to be affiliated with some sort of group. So whether you are a CERT team member with your county EMA, a member of your local volunteer fire department, or even joining a national organization like Team Rubicon, the American Red Cross, it's best to be affiliated with somebody. And then if you're interested in going to North Carolina to respond, you're going with the group. So you've been properly vetted, your training is documented, you're going with support. Because oftentimes, like after Hurricane Katrina is one example, you had a lot of really well-intentioned people that were just showing up and, maybe showing up with, a bulldozer, heavy equipment, because they knew that those items were needed. But in the end, they ended up just kind of congesting the roads. They were eating up resources because they have to be fed. They need fuel. They need to sleep somewhere. So that kind of distracts from the organized response. So, great to help your immediate neighbors in that, first 72 to 96 hours after a disaster. But past that point, you really want to be affiliated with a group.
Great, thank you very much. So do we have any other questions for Aaron this morning? You can either come off of mute and ask those, or you can put that in the chat box. We do appreciate Aaron being on this morning. It's been a busy week, I'm sure. Okay, I'm not hearing any questions. So Aaron, if you need to, you can jump off. We do appreciate it.
All right. Well, thank you so much for inviting me. And
yeah,
I
thank you.
hope to meet you face to face fairly soon. Welcome to come out here anytime.
Great, thank you very much. All right, so I'm on my cell phone and I can hear through the computer, but I can't communicate on the other side without my phone. So it's a little bit unique this morning. So just wanted to follow up on reminders. I think I've heard back from pretty much everybody on this call. But if I haven't heard back from you, please do connect with me about keeping your name on our active list. And this is for our membership coalition list. It was outdated. I get a lot of emails kicked back to me. So I was just kind of updating it, keeping it refreshed. So if you haven't reached out to me, or someone that hasn't reached out to me, please do. We just want to make sure that we have the most accurate list. I think there's probably about 92 people that I haven't heard back from. Some of those people have moved on to other areas. But we don't know where everybody is currently. So let's see. For 2025, we're going to try something a little bit different. So this year we went to a quarterly format, which we're going to keep, but we're going to do kind of 2 over WebEx like we're doing today, and then we're going to do 2 in person. Now, I haven't been able to set those locations yet, but they will probably be in the Carbondale area. That seems kind of center for most of us. So once we have those locations set, I will let you know. But at least for calendars right now, we're going to do January 16th. These are all Thursdays at 8:30, so the same time. January 16th via WebEx, April 17th in person, July 17th over WebEx, and then October 16th in person. So we get kind of the best of both worlds, and we'll see if people prefer going back to in person. I think we've kind of been, anxious, and then, with COVID and some other things, we're just tentative right now. So we'll kind of see how this rolls out in the next year. And I'm seeing a lot of excitement in the chat, so that's good news. And I'll be sending out appointment reminders for people's calendars as well. So a couple things that I wanted to mention before we get into community reports. Can everybody see that?
No, Matt, I don't see anything on the screen.
Okay. Okay. Hopefully you can see that. So it's a Word document here. So basically, I just wanted to let everybody know that our Jackson County Health Improvement Plan, or our I-Plan as we sometimes call it, so that was recently approved by the Illinois Department of Public Health. And some of you have been engaged for the last year, which we really appreciate. So that's our 5-year health improvement plan. Now, it is a requirement. Every county health department in the state needs to do these every 5 years. But we're really focused on getting community input. We've done surveys. Basically, it's a year-long process. And I know several of you have helped out, so we really do appreciate that. But I just wanted to go through kind of these 3 priority health areas that we settled on, and then some of the strategies and the interventions. And this is actually on our Jackson County Health Department website as well. So if you want to go through the full plan, it's on there. We're basically just looking at the executive summary, so there's a lot more detailed information in the actual plan. And that's in our community health section on our website. So the 3 priorities, so we're addressing behavioral health, and that includes mental health and substance use. The second is focusing on community-wide health equity, and then also chronic disease reduction. And then the third is basically, we're calling it improving family and community engagement that are really impacting social determinants of health. So some of you have probably heard that term. It's been around for a while, but really the public health field is taking a stronger look at social determinants of health, because where you live, your education level, all of these things impact your health down the road. And we've actually seen the data on that. So that's something that we're really wanting to focus on over the next 5 years. So for behavioral health, I'm not going to read all this information. This is pretty common sense. So obviously, we want access to mental health services. We want to decrease substance use. And then also we want to decrease stigma. So if people feel attacked or they're embarrassed about getting treatment, they're probably not going to. So we really want to reduce that and eliminate those barriers. And there's the 211 line, the 988 line. There's another line that we promoted. I think it's out of the northern part of the state, but basically it's a remote mental health service that people can reach out over the phone. So there's a lot of good resources out there for getting people the help that they need. So that's kind of all I'll say for there. The second one, overall population wellness. That's, any area that you live in, you want to make sure that you have a healthy community. We want to make sure that we're focusing on the community as a whole, but also making sure that the at-risk individuals aren't slipping through the cracks. And that's something that we feel really needs to be addressed. There's definitely marginalized groups that get worse health outcomes that we need to be addressing. So that's going to be very important over the next several years. This one I do want to touch on, health literacy. Basically, that's getting individuals to kind of a standard understanding of what they should be doing, whether that's getting annual routine health physicals, getting connected to health insurance. There's honestly still people out there that don't have health insurance. So we want to make sure that we can connect those people so they can get services that they need. And then just kind of a general health awareness in the community about, you know, proper nutrition, physical activity, all of these things that impact health. And for the health people in the room, we know this, but not everybody does. So we want to make sure that we're addressing those as well. And then for family and community engagement, this one's a little bit unique. Obviously, the poverty, that's been an issue in our area. I continue to see it. I think the Carbondale Warming Center had to expand multiple times. We had them on last quarter for a presentation, or maybe 2 quarters ago, but they're seeing a tremendous amount of need. But then also, I'll touch on this one. We want to make sure that the children are in high quality early childhood education centers, and then that carries through basically K through 12. So for our area, we kind of refer to them as ECEs. That's just kind of the acronym for early child care education centers. But the ECEs, there's not many of them, and most parents will tell you they're fairly expensive. So we want to try and address that, get kids that aren't into the K through 12 system, making sure that they're getting quality education, and that includes nutrition, physical activity, sun safety. There's kind of a long list of items that we want to focus on with ECEs. So that's all I'll mention there. So if we have any questions, I can address those. I think Angie sent the link. Thank you, Angie, for sending that directly to our plan. So that really has more detailed information. And I will be sending out our quarterly update report, which will have those specific information in there as well. So that's something I'm still working on, but that should be coming soon. So do we have any questions about this, at least initially? Go ahead, Diana.
I was just wondering, for the in-person locations, if you are needing a location, I'm sure I can look at the Civic Center for you, if that makes sense as a potential location. I'm not too sure what you're aiming for.
Okay, well, great. I do appreciate that. So that is a possibility. What I'm hoping to do is to kind of do venues that might have the ability to do a little field trip kind of adjacent to the meeting location. So that's definitely an opportunity. So I'll be in touch if that's something that we think can make work. We appreciate that. I thought I saw somebody else's hand. I'm just scrolling through my list. So if somebody else had a question before Diana, just go ahead and raise your hand again and I'll. Okay, not seeing anything. So let's go ahead and jump into action team reports. Now, I don't know if we have Amanda Holloway on for Behavioral Health Action Team. Some of these reports might be a little delayed. So the good news is we record this and we'll post this information online at JacksonCoHealthDept-Illinois.org once we do get the information. I know a couple of the committees might be kind of in a holding pattern just because some folks have moved on to other roles. So this report might be a little bit more limited than usual. Do we have Molly on from City of Carbondale and the Built Environment Action Team? I don't see her name, so I definitely know Fonsa is on. Do you want to give the Diabetes Today resource team update?
Yes, I can do that. And Matt, I will send DTRT and Joint Access to Care info to you after the meeting. So
Okay,
for
great.
Diabetes Today resource team, since we last met, Camp Beta 2024 took place at Touch of Nature on September 7th and 8th, and a total of 14 boys and girls ages 10 through 17 living with type 1 diabetes attended. And we do have the photos posted on the HSIDN webpage. So at the very top, there's a tab for Camp Beta, and there's photos from 2016 all the way down to this year's camp. Camp Beta 2025 will take place in September of 2025, so final dates to come. So we do want to just continuously thank and appreciate our sponsors, as this camp we know would not be possible without their support. So November is Diabetes Awareness Month, with November 14th always observed as World Diabetes Day. So DTRT, we're currently still planning an activity for that day, but our current plans include a social media campaign to launch throughout the month. We have an upcoming meeting next week to finalize everything, and we'll be sending the update in the HSIDN, one of the HSIDN Friday updates. As an action team, we continue to recruit new members. So if you're interested in joining or know someone who might be interested, I will put my email in the chat. Feel free to contact me, and I'll also drop Debbie's email in there as well, or you can contact Debbie. Next meeting next week, October 24th, from 11:30 to 12:30, and we meet virtually. Thank you.
Great, thank you very much, Fonta. Tony K, I think I saw your name. Do you want to give your Healthy Living Action Team report?
Yeah, thanks, Matt. So our co-chair, our co-chair is Claire Hughes with the Little Resource Center. So she joined our co-chair earlier in the summer. We are kind of relooking at, similar to what Matt said about the membership list of the overall coalition, we are also in the process of updating our overall, or our action team's membership list. And during our next couple of meetings, we will be reviewing our successes over the last few years as our strategic plan is coming to an end, and begin planning our strategic plan, our action team's strategic plan for the next several years. So if you'd like to join us, please reach out to myself or Claire. The Food Security Summit was held on August 27th. We had good attendance and good feedback. We will be awarding some mini grants from that in the coming weeks. We do just have scheduled our next Southern Illinois Food Pantry Network meeting, which will be held on November 6th, with RBEC sharing information on food waste and recovery. There will be opportunities for attendance in person or virtually. And if you're interested in food waste and recovery and not involved with the Food Pantry Network and would like to participate in some way, please, again, reach out to me, because I think that goes beyond just food pantries. The Catch On to Health Consortium recently held a PE workshop and a school food service training with good attendance and good feedback on both of those topics. Our next meeting is scheduled for November the 4th at 1 o'clock. And again, we do have virtual or in-person options for attendance, for engagement. And we meet at the Carbondale Park District office at Lakeland School.
Great, thanks very much, Tony K. So I did see Becky's name on for Healthy Senior Action Team.
Yes. Sorry, I'm having trouble with my internet today, so I have better if I don't have any camera. But our Healthy Senior Action Team is putting on the caregiver retreat. Of course, I know everyone's getting tired of these updates, but the event is right around the corner, November 1st. If you can, please share this flyer out. We need some more people to register. Our ideal audience here is unpaid in-home caregivers. That's who we're really designing this event for. The events of the details are on the flyer, but I'll just run over them really quickly. November 1st, 10 a.m. to 2 p.m. We have breakouts for them to enjoy. The cosmetology students, of course, from Johnny Logan are going to come and pamper them with some manicures and some basic hand massages. We have 5 massage therapists coming to provide a seated chair massage for them. We have yoga breakouts. We have some putt-putt golf. We have some really dynamic speakers presenting on some wonderful topics to focus on positivity and just the caregiver's overall health. So we're really excited about putting this together, and the team has worked so hard to make this event fun, and I'm excited to see what comes of it. I'll look forward to reporting out at our next meeting.
Great, thank you very much, Becky. Fanta, do you want to give your joint access to care update?
Sure, I could do that. So Joint Access to Care continues to, we just met this week on Tuesday, but we continue to review and maintain the HSID and resource guides. And as we do that, we're also keeping in mind our overall goal to improve access to behavioral health, medical, and dental services through the set team strategies. And all of the strategies are listed on our one-pager that you can find on HSIDN under the Jackson County Healthy Communities Coalition action teams. So some members are currently working with the Find Help exploratory group to determine how best to assist in the implementation process of this community resource platform. Just a few reminders: open enrollment for Medicare did start this week on October 15th, and that will go through December 7th, with open enrollment for Healthcare Marketplace to begin November 1st through December 15th. And just like DTRT, we continue to recruit new members. And at the last meeting this week, we've identified a few representatives that I'll mention them, but we would like, if you are on this call and interested in participating or know someone that you could send to our meetings, that would be great. But we're looking for representatives from MCOs, Gateway, SIU Community Dental Center, SIU School of Medicine, Social Services, CRH, I can't say it all, but CRHSSD, and then RMTD, and then Jackson County Mass Transit, and I believe their new name is JAX now, JAX, and then Rainbow Cafe representative, EAAA, Carbondale Warming Center, Good Sam in Carbondale, the Lighthouse Shelter in Marion, as well as Task. And if you're interested in joining, please contact myself or Alicia, and I will again put our email in the chat. We are currently planning for 2025, and we will be transitioning from meeting every other month to quarterly hybrid meetings. But in between, we will continue to keep active email communication. Our next meeting is December 17th at 2 to 3, and it will be virtual. Thank you.
Great, thank you very much, Fanta. I was just going through the chat. Aaron wanted to know, Becky, does this flyer with the caregiver retreat, does that live somewhere online, or can you send that out to the group?
I will absolutely send that out to the group.
Okay, thank you. Let's see, so Sherry for Positive Youth Development.
All right, Matt, I did send this to you this morning. Sorry, I had forgotten to send it earlier. So we have been working on our strategic plan, updating our contact list and planning family vacation nights for the rest of the year and into next year. So September, our family vacation night was on September 26th at the Carbondale Public Library. That event included a performance by 123 Andres, a dance group. We had story time, vendor tables, and a whole lot more. There were about 150 attendees. Everybody seemed to have a lot of fun. The weather held out up until the very end. The kids seemed to be engaged with the performers, and it was a lot of good community engagement. October, we just had an event on Saturday the 12th. We had about 160. That was the most we'd ever had out there at Millier Orchard in Murfreesboro. We had pumpkin decorating, gave out donuts, costume parade, face painting. We had a story walk, games, and vendor tables. We ran out of pumpkins and decorating kits. Donuts and slushies were appreciated by everyone. We had a kid ask us for the recipe. Sadly, I had to tell him that I did not make the donuts, but he could go ask inside. And great family engagement. We saw a lot of families going to pick apples after the event was over as well. November, we will be partnering with Carbondale Public Library for a family reading night, and it will be Mo Willem themed. So we will have opportunities to assist with the reading, or organizations can set up vendor tables. December, we'll be helping to promote Santa in the park. Each year they ask for mittens, hats, scarves, and snacks, and there will be an opportunity to help pack the bags for that. January, we typically don't have an event, but that's to be determined. And then some very early planning is going on for February. We're going to bring back our Valentine's family dance again this year. Planning is underway. We are looking for a location for that. And we will be partnering with SIU Credit Union in the spring to have an event at the Science Center at the mall. So details are still being worked out there. And I want to mention that all of these events do take quite a bit of work to make them happen. So we are always on the lookout for members to take the lead on a project, or even community partners that would want to take the lead on an event, or even to assist. We meet on the third Tuesday of each month by Zoom at 1 o'clock. You can contact me to get added to that PYD contact list.
Great, thank you very much, Sherry. I heard the event on Saturday at the Orchard was very well attended. So I think most of your events are very well attended. So for public health and medical preparedness, so Bart Hagston, he was our administrator here at the health department. He's since moved on to take a state job at IDPH in Marion. He was kind of overseeing this. So currently this group isn't active, and we're kind of having internal discussions about if the Spark group kind of meets this need, or if we need to bring this back. So we're still figuring that out. So we'll move on to Sexual Health Action Team. Is Philip on? I know Philip was in the building. He might be occupied, so we can move on. So Southern Illinois Cancer Action Network, Angie Bailey.
Yeah, so I played chat as well. We had our last meeting on September 17th. Our next meeting will be November 19th at 2 p.m. If you're interested in joining and not already part of our team, you can contact myself or Emma Ray, and she can get you on that meeting invite. At the last meeting in September, we had a guest speaker from the National Ovarian Cancer Coalition. I put a little bit more information in the chat. If anyone is interested in getting in touch with her or learning about their resources, Jennifer can assist. She shared a lot about the services they can do to support individuals with ovarian cancer to address social determinants of health. So, transportation to appointments, or can't make their co-pays, or they have lots of different financial resources as well if someone is diagnosed with ovarian cancer. So that was helpful to learn more about. The Hope Light Foundation held their Walk for Hope on Saturday, October 5th in Metropolis. So many individuals went to that. And it's a fundraiser, so they can also support those living with cancer. Since October is National Breast Cancer Awareness Month, many events and promotion and things are happening. So SIH Health and various partners held a mega breast exhibit on October 3rd. So you might have seen that on social media or the news. It was a really interesting display, and people were also available to schedule mammograms right there. And then Shawnee Health and many partners will be hosting an event this Saturday, October 19th from 10 a.m. to 2 p.m. at the Harley Davidson in Marion. So if you are not already receiving the Friday HSIDN updates, make sure to go to the website and sign up for those. And you'll see many of these flyers in that Friday update. Still looking for a co-chair. And then again, as I mentioned, our next meeting is November 19th. And then I did attach the link in the chat for the fact sheet of the purposes of our group. So we do a lot of information sharing and networking around resources, new things people have found out about, any upcoming events agencies and entities are planning, so we can share and promote and be at each other's events. And then really focusing on breast, lung, colorectal, ovarian cancers. So thanks. Reach out if you have any questions.
Great. Thank you very much, Angie. So moving on, just a couple other items that I did receive. So there's I believe next Thursday, October 24th at 5:30. There's an opportunity for discussion with Mayor Harvey. Diana, was there anything additional you wanted to say about this?
I did want to say, because we've had such a wonderful response, we actually have decided to move that to the Civic Center. But we're still, I don't want to tease you with good pizza and take away that. So we're still going to be catering that event with Pag's Pizza. But when you do RSVP, you RSVP with Faith Johnson, and then we'll remind everybody of the switch of location. So, but just wanted to make everyone aware of that.
Great, thank you very much. That's good that it's going to be well attended. So behind the uniform, I don't remember who sent this to me.
It's
I
me.
think it was Land of Lincoln. I don't. Okay,
Yeah,
go ahead,
it's me.
Jessica.
Can you hear me? Okay. Hi guys, it's Jessica Palazzolo with Lincoln Prairie. I'm new to this group, but I'm not new to this world. So several of you I've known for many, many years. But we are an inpatient psychiatric facility. So speaking of that behavioral health piece, but this specifically, one thing that my team works really hard to do is provide a free training each month virtually. And so this is the flyer for our next event, and it's in honor of Veterans Day. We are teaming up with a great provider. They're called Star Behavioral Health, and they do training specifically to help providers learn more about working with military connected individuals and families. So if you're at all interested, please go to the link and sign up, and you will get the information either the day before or the day of the training, so you can have that. So just wanted to make sure everybody knew about that. Thank you. And if anybody doesn't know me and wants to make a time to meet and learn about our service, to do that. So I'll drop my email in the chat box. And thank you so much.
Great, thank you very much, Jessica. So do we have any other community updates, anything else that we need to know? You can always email me this. I'll wait at least a couple days, and then I'll put all of this information in. And like I've mentioned before, this does go on our Jackson County Health Department website, so you can refer to this. The chat all gets included, so we will capture all of this. But anything else that anyone wanted to share? Go ahead, Angie Bailey.
Yeah, so we have been doing with a variety of different entities a barbershop tour. So the first events were held focusing on prostate cancer and just the importance of insurance and how your insurance works. And those were held at Arnett's Barbershop and Quality Cuts in Murfreesboro and in Carbondale. The second in the series has been on mental health. So we had the first event at Campus Cuts in Carbondale, and then the second event for that will be on November the 11th at Quality Cuts in Murfreesboro next to the Rural King. So Fonta's put the message in the chat, and again, those are in that the flyer has been in the Friday HSID and update. So just want to get more people out. We had I think 13 at one of those events and about 18 or 19 where the barbershop was packed. You couldn't fit another person in the one in Murfreesboro. So that's been a great event. And if anyone has any materials you'd like to send to that, or feel free to promote and help us get even more people there. Thank you.
Great, thank you very much, Angie. So do we have any other updates for this morning? Angie K, go ahead.
Hi, thanks, Matt. I just wanted to put a plug out there for CarbondaleHalloween.com. There's a ton of information on all the activities that are going on in the month of October in the Carbondale area. Spooky Catalyst race happening out at Touch of Nature. The pumpkin race, I guess they're not showing up on my screen. The pumpkin race downtown. The Safe Halloween. The Day of the Dead activities, the candy walk, the arts and crafts make and take, the outdoor horror movies, and the big one that I want to highlight is the pumpkin smash activities that we're doing out at SIU Farms on November 9th. We have the engineering students making a 7-foot trebuchet to launch some pumpkins. We'll have healthy pumpkin recipe samples. Tony Kay and her team from Extension will be there. We'll have arts and crafts and just many different ways to smash a pumpkin out there. But if you want to check out all of the fun activities going on throughout the month of October in the Carbondale area, CarbondaleHalloween.com. They're all listed on there. Thanks.
Great, thank you, Angie. So go ahead, Sherry.
Yeah, we have a youth mental health first aid training coming up. That will be November 14th at John A. Logan College. You can contact me if you would like the flyer, and I'll send that to you as well, Matt. And I have included my email address in the chat.
Okay, great. I know those are very well attended as well. So anything else for this morning?
I forgot one thing.
Go ahead.
Our Jackson County solid waste plan is in final draft form. We expect that draft version will be available on or thereafter October 21st. There is a 90-day comment period for this county solid waste plan. And if anyone would like an advance copy or would like to be involved in reviewing that plan, please let me know at the health department. Thank you.
Great, thank you, Angie. So Emma B, because I know we have two Emmas. Before we jump off, if Emma would stay on, hopefully we can figure out my audio so we don't have to do this the next time with the cell phone. Other than that, I'm not seeing anything else in the chat. Erin, we do appreciate you for presenting this morning and staying on. And other than that, if you have any updates, again, you can email those to me in the next couple of days, and I will include those. And other than that, hope everyone enjoys the nice fall weather while we have it. So I appreciate everyone being on this morning.
Thanks. Bye.
So Emma, just give me a second here. I'm going to try and mess with my audio. I don't know what's going on.